Hey Amanda, how are
Morning.
you doing?
Doing well. How are you? Thanks for all the
Awesome.
coordination. Really appreciate it.
No, this is great. And congrats on the launch. Oh my goodness. How
Thanks.
exciting.
We're very excited.
Congrats to you guys. What a big push. Exciting days.
Truly.
Well done.
Thanks so much, Emily. Well, yeah, I mean, if we can just jump right in, I would love to hear more about the rebrand. Why Brightline? Please tell us more.
Wonderful. Maybe I'll start, and Amanda, feel free to hop in. Yeah, so we're really excited. We have been, since we started the company, speaking a lot with families and just trying to really uncover what are the most common challenges that families face when it comes to getting great support for their kids. And I think one of the themes that we've heard over and over again is this notion that parents and caregivers often just don't even know what is the path, what is that line of sight to getting care, where do we start, what does treatment look like, how do I know how my child's progressing? And parents live in what I often call the gray zone. And as a mom of 3 kids, I have often been in the gray zone with my own children when it comes to their behavioral health of where do I even go? And so we really wanted to create a name and a concept and a brand that really helps families feel like they've got clarity, they've got line of sight to a brighter future, they've got line of sight to what great care looks like and how they as parents and caregivers can be part of that care delivery system for their kids. So the notion of Brightline is creating a line of sight to a brighter future for families.
Thanks for that. And can you tell us more about, you mentioned the telehealth in the presentation. Can you tell us more about that?
Sure, David, do you want to talk a little about that?
Yeah.
And maybe intro yourself to. I think that everyone knows who you are from the overview. But
nice to see you guys. So great to see you. My name is David Grodberg. I'm the Chief Medical Officer of Brightline, and I'm a child adolescent psychiatrist and adult psychiatrist. And for years, I've been medical director at the Yale Child Study Center. And we know very well that telehealth can be very effective for pediatric behavioral health. And we're so excited to improve access to care this summer, especially during the public health crisis. But what it's going to be able to allow us to do is not only to provide reactive care, that is to help children and families when they're in a crisis, but to also provide proactive care and to allow telehealth to be a vehicle for coaching and parent-mediated interventions, not in addition to psychopharmacology, for example.
Gotcha. Thanks for that. One of the big bottlenecks is the fact that there's a lack of Davids, right? There's a lack of child psychiatrists. So, when the goal is to get kids to care quickly, any unique ways you're going to be able to get kids to care as far as is it triaging, using NPs? Like, how are you extending the reach of a child psychiatrist?
Yeah. I'll start, David, and then you should hop in. One thing that's important to point out, David Recupero, is that we're not just providing child psychiatry. So Brightline is multidisciplinary. So we've got psychology, psychiatry and prescribers, occupational therapists, and speech language pathologists. And there's frankly a shortage across all of those domains. So it's a really important question. We're doing a number of things that have been proven to work in small pockets, but nobody has scaled across the country. And so there's a number of things, including exactly what you said, triage, just looking at getting families to the right clinician first, rather than this sort of hunting and pecking experience where families will, try to go see an OT first when they really should be seeing a behavior therapist, or start with a psychiatrist when they really should be seeing a behavior therapist. So we do multidisciplinary intake in order to get families to the right clinician the first time. The other thing we're doing is, this sounds obvious, but we're taking a lot of the admin hassle and care coordination load off the backs of the clinicians. So it allows our clinicians to really focus on delivering great care. And the way we're doing that is by staffing a multidisciplinary clinic where we've got folks that handle the admin side, the scheduling, the insurance discussions, as well as a coach for every family that supports care coordination with schools and pediatricians. And then we also, one of the things I think David has just led so tremendously for our business is making sure we're using evidence-based protocols with fidelity checks for every step of treatment and supervision. So we are very quickly able to calibrate what's working and what's not working for families, so that we can, hop in very quickly after each treatment session and assess, is the child progressing towards their clinical objectives, and then calibrate so that families don't waste a lot of their own time and money, and also that our clinicians are performing the most effective care they can. David, would you add other stuff, or would you change anything I said?
I would not add. I would not change anything. The only thing I could maybe would add to it is that we're using a lot of evidence-based parent training approaches that are called parent-mediated interventions, and that's when you actually train parents to do the same thing that the experts do. And these are interventions that not only improve the child's outcomes, but have been shown to change service utilization down the road.
David's being modest. In part of his scope and research and role at Yale has been actually building and running research around these parent-delivered interventions, which can be delivered over technology, a hybrid of a digital intervention that you teach a parent how to do with their kids, and then you provide a live coaching session to educate the parents about how to be most effective. And I think about my oldest son who had pretty acute anxiety for a number of years. I had no idea how to, like, what's a body map, what's CBT. I had no idea how to be effective. And for many kids, actually the parent involvement and parent intervention is one of the most effective ways to help a family.
Yeah, and one of the things we found out in the work at Yale is that just brief and focused coaching can go a long way.
Okay, great. Thank you. Looks like, well, we're turning the corner here for the end of the session. Salome, do you want to add anything before we go?
Yeah, no, we've just gotten so many great questions. So everyone dropping in your questions for the Brightline team, we'll plan to follow up, but we've got to head over to the next session. So thanks so much, Brightline. Really appreciate this.
Thank you guys for all your work.
Thank you.
Bye-bye.